This painkiller sends thousands to the emergency room every year. What your doctor might not be telling you could save your life. Stay with me because what you're about to learn about Tramadol will shock you. Tramadol is one of the most prescribed opioid painkillers in the world. Millions of people take it every day, thinking it's completely safe. But behind this common prescription lies a complex drug with serious benefits and potentially life-threatening dangers. I'm going to break down everything you need to know about Tramadol, its legitimate medical uses, the benefits that make doctors prescribe it, and the hidden side effects that could put you at serious risk. By the end of this video, you'll have the complete picture that every patient deserves to know. Let's start with what Tramadol actually is. This painkiller sends thousands to the emergency room every year. What your doctor might not be telling you could save your life. Stay with me because what you're about to learn about Tramadol will shock you. Tramadol is one of the most prescribed opioid painkillers in the world. Millions of people take it every day thinking it's completely safe. But behind this common prescription lies the complex drug with serious benefits and potentially life-threatening dangers. I'm going to break down everything you need to know about Tramadol, its legitimate medical uses, the benefits that make doctors prescribe it, and the hidden side effects that could put you at serious risk. By the end of this video, you'll have the complete picture that every patient deserves to know. Let's start with what Tramadol actually is. Tramadol is what doctors call a centrally acting opioid agonist and SNRI. That sounds complex, but here's what it actually means for your body. Unlike other painkillers that work in your muscles or joints, Tramadol goes straight to your brain and spinal cord. It works in two powerful ways. First, it binds to opioid receptors in your brain, blocking pain signals from reaching your consciousness. Second, it increases levels of serotonin and norepinephrine, which are natural chemicals that help reduce pain perception. Think of your pain signals like cars on a highway. Tramadol essentially puts up roadblocks, preventing most of these pain messages from reaching your brain. This dual mechanism makes Tramadol unique among painkillers. It's stronger than over-the-counter medications, but considered safer than stronger opioids like morphine or oxycodone. However, this unique action also creates some unexpected risks that we'll explore. Doctors prescribe Tramadol for moderate to severe pain when other medications haven't provided relief. It's particularly effective for chronic conditions like arthritis, fibromyalgia, and long-term back pain. After surgery, Tramadol helps patients recover more comfortably without the intense side effects of stronger opioids. Cancer patients often use Tramadol for ongoing pain management when their regular medications need support. The drug is especially valuable for elderly patients who can't tolerate stronger painkillers due to their age or other health conditions. Tramadol also helps people with diabetic nerve pain, a condition that's notoriously difficult to treat. Unlike some pain medications, Tramadol doesn't cause severe stomach problems or increase bleeding risks. Many patients find it allows them to function normally while managing their pain. For people with chronic conditions, this can mean the difference between being bedridden and maintaining an active lifestyle. However, these benefits come with important considerations that every patient needs to understand. Like all medications, Tramadol causes side effects in many patients. The most common ones affect about 10 to 25% of people who take it. Nausea is the biggest complaint, often starting within the first few days of treatment. Many people feel dizzy or lightheaded, especially when standing up quickly. Dry mouth is extremely common and can be quite uncomfortable. Constipation affects most patients and can become serious if not managed properly. Drowsiness and fatigue make it dangerous to drive or operate machinery. Headaches occur frequently, sometimes daily, in the first weeks of treatment. Sweating increases noticeably, even in cool environments. Some people experience vivid dreams or sleep disturbances that affect their rest quality. Loss of appetite is common and can lead to weight loss over time. Most of these side effects decrease as your body adjusts to the medication, usually within 2 to 4 weeks. However, some people never fully adjust and must weigh the pain relief benefits against these ongoing discomforts. If these common side effects become unbearable, talk to your doctor about adjusting your dose or trying alternatives. Now we need to talk about Tramadol's dangerous side effects that can be life-threatening. Respiratory depression is the most serious risk. Tramadol can slow or completely stop your breathing, especially when combined with alcohol, benzodiazepines, or other opioids. This breathing problem can happen suddenly and without warning. Serotonin syndrome is another deadly risk that occurs when Tramadol interacts with antidepressants, migraine medications, or other drugs that affect serotonin levels. Symptoms include high fever, rapid heart rate, muscle rigidity, and altered mental status. Without immediate treatment, serotonin syndrome can be fatal. Seizures can occur, particularly in people with epilepsy or those taking certain medications. These seizures can happen even at prescribed doses. Severe allergic reactions, including anaphylaxis, have been reported, causing difficulty breathing, swelling, and dangerous drops in blood pressure. Heart rhythm abnormalities can develop, especially in people with existing heart conditions. Tramadol can also cause severe drops in blood pressure, leading to fainting or falls. Mental health changes, including suicidal thoughts, have been reported, particularly when starting or stopping the medication. These dangerous effects are why Tramadol requires careful medical supervision and why you should never adjust your dose without consulting your doctor. Tramadol is classified as a Schedule 4 controlled substance because it has significant addiction potential. Despite being marketed as safer than other opioids, Tramadol can be highly addictive, especially with long-term use. Physical dependence can develop within just a few weeks of regular use, even at prescribed doses. When people try to stop Tramadol, they often experience withdrawal symptoms that can be more severe than with other opioids. Anxiety becomes overwhelming and can last for weeks. Excessive sweating occurs day and night, disrupting sleep and daily activities. Insomnia can persist for months, leaving people exhausted and unable to function. Tremors affect the hands and entire body, making simple tasks difficult. Nausea and vomiting can be severe enough to require medical intervention. Unlike typical opioid withdrawal, Tramadol withdrawal also includes unusual symptoms due to its effect on serotonin and norepinephrine. People report electric shock sensations, severe mood swings, and intense cravings that feel impossible to resist. The psychological aspect of Tramadol addiction is particularly challenging because the drug affects mood-regulating brain chemicals. Many people find they cannot function emotionally without the medication. Professional medical supervision is essential for safe Tramadol withdrawal because stopping suddenly can trigger seizures or severe mental health crises. Certain groups of people should never take Tramadol due to serious health risks. Pregnant women face significant dangers because Tramadol crosses the placenta and can cause life-threatening withdrawal symptoms in newborns. These babies may require intensive medical care for weeks after birth. Breastfeeding mothers should also avoid Tramadol because it passes into breast milk and can cause serious breathing problems in infants. People with severe liver disease cannot process Tramadol properly, leading to dangerous accumulation in their system. Those with kidney disease face similar risks because their bodies cannot eliminate the drug effectively. Elderly patients over 75 radiate higher risk for confusion, falls, and breathing problems because their bodies process medications more slowly. People with a history of seizures should avoid Tramadol because it significantly increases seizure risk. Those taking monoamine oxidase inhibitors face potentially fatal drug interactions. People with severe respiratory problems like sleep apnea or chronic obstructive pulmonary disease are at extreme risk for breathing complications. Individuals with a personal or family history of substance abuse need careful evaluation because Tramadol's addiction potential may be higher for them. People with severe mental health conditions, particularly those with suicidal thoughts, require close monitoring because Tramadol can worsen these symptoms. Always inform your doctor about all medical conditions and medications before starting Tramadol. Following these safety guidelines can help you use Tramadol more safely if your doctor prescribes it. Always take exactly the dose prescribed at the exact times recommended. Never increase your dose or take it more frequently, even if your pain gets worse. Store Tramadol in a locked cabinet away from children, pets, and visitors who might misuse it. Never share your Tramadol with anyone, even family members with similar pain conditions. Keep a complete list of all medications, supplements, and vitamins to show your doctor and pharmacist. This helps prevent dangerous interactions. Never drink alcohol while taking Tramadol, as this combination can stop your breathing. Avoid driving or operating machinery until you know how Tramadol affects you personally. Set up regular appointments with your doctor to monitor your response and watch for signs of dependence. Keep track of how much pain relief you're getting and any side effects you experience. Learn to recognize signs of serious problems like difficulty breathing, chest pain, or unusual mental changes. Have a family member or friend watch for these warning signs too. Create a plan with your doctor for eventually stopping Tramadol safely when your pain condition improves. Never stop taking Tramadol suddenly without medical supervision. Always carry a list of your medications in case of emergency. Most importantly, maintain open, honest communication with your healthcare team about how you are feeling physically and emotionally. Tramadol can be an effective tool for managing serious pain when used correctly under proper medical supervision. Remember the key points. It's a powerful medication with both opioid and antidepressant effects. It has legitimate medical uses for moderate to severe pain. Common side effects include nausea and dizziness. Dangerous side effects can be life-threatening. Addiction and withdrawal are real risks. Certain people should never take it, and safety precautions are essential. The most important message is this: never make decisions about Tramadol without consulting qualified healthcare professionals. Your doctor can evaluate your specific situation, medical history, and current medications to determine if Tramadol is right for you. If you're currently taking Tramadol and experiencing concerning symptoms, don't wait. Contact your healthcare provider immediately. Knowledge empowers you to make informed decisions about your health. If this information helped you understand Tramadol better, please subscribe for more evidence-based health content. Share this video with someone who might benefit from this knowledge. Remember, your health decisions should always be made in partnership with medical professionals who know your complete health picture.